Hello, everyone, and welcome to today's Elevate Office Hours session. My name is Luke Ertl, and I'm the Program Manager with the Quality Center within the Clinical Affairs Division at NACC. I'm joined today by Cheryl Modica, Director of the Quality Center, and Camila Silva, Specialist of Health Science Content. I'd like to review a few housekeeping items as we get started. There will be lots of chances for discussion throughout the webinar today. Our webinar will not be a normal webinar format where it will be 40 or 50 minutes of presentation and then Q&A. We'll have short presentations with lots of discussion points throughout. So please send us your questions via the chat box at any point during the webinar, or as you can see on your screen, there will be points where we'll be opening up the lines. So you can click the raise your hand button down in the bottom right-hand corner of your screen, and that way you'll be able to raise your hand and we can unmute your phone. Today's call is being recorded, and the slides and recording will be made available, on Friday on the Elevate Learning platform. And a link to access the learning forum is included in the bottom of your calendar invite. With that, let's go ahead and get started. I'll now turn it over to Cheryl Modica.
Great, thank you, Luke, and welcome all to Elevate 2021. As Luke said, this is an office hours and really designed to be an interactive opportunity to hear your voices and also provide you support, particularly around the Value Transformation Framework assessment. And we'll get to that in just a few moments and certainly answer any questions and talk a little bit more about the assessment itself. We just want to remind those of you, particularly those who may have joined at any point possibly last year, may not know who's on the line or who the Quality Center team is, just wanted to provide a visual again. So myself, Cheryl Modica, Director of the Quality Center, you heard Luke's voice a moment ago, and in a few moments you'll hear Camila Silva's voice. So again, that is the team from the Quality Center that brings you Elevate 2021 and here to support you throughout the year. We're going to speak much more about this slide. In fact, this will be a slide that you see throughout the monthly Elevate Learning Forums during the course of this year and in any optional series that occur during the year as well. So today's call, we won't dive down so much, though I will spend just a minute or two providing some context because I think it is helpful for any of the Q&A that might come up today, and it also is related to our Value Transformation Framework assessment. And if you note top left of your screen, you'll see that that is the Value Transformation Framework visual, that is the graphic, and what is our underlying conceptual model or framework that organizes our approach and drives our work. Each of the icons around that circle are also represented under the escalator. And so the escalator represents our learning community, our Elevate learning community that we hope you are all a part of, and I'll say some more about that in just a moment. And again, there are the 15 change areas of that conceptual model, and we'll use, again, the monthly forums and a variety of different learning formats over the year. We're excited to be bringing you some new formats, some self-paced modules that are being launched, some additional virtual tools and hand sort of guides. Peer exchange continues in a variety of other formats. So again, that is kind of the centerpiece of our work is represented in that escalator visual. You will see off to the right of the screen that we're referencing some reimagining and innovate work, and so that will evolve a bit over the year, in part with some of your influence and your feedback, but there will be more opportunities to engage in innovation and work over the course of the year. With that, and I do see one person's asking about audio, so if we can ask Luke or Camila to support some folks if they're having some trouble hearing, but I think we'll proceed forward with that. So in this next slide, this is really just to reinforce or represent that what we hope is the value in the Elevate Learning Forum and really with the Value Transformation Framework itself is to help bring some structure, some organizing approach in what is a very much a changing and frankly a chaotic world in many respects today. And so you can see COVID, certainly, I don't need to tell all of you, you live it each day, whether it's response to COVID or the vaccine or any one of the COVID related items. So this organizing approach is very much about supporting transformation and systems change and resiliency in this changing world, while at the same time being flexible and nimble enough to be open to and support and have a forum together with your peers around reimagining and innovation. So we're thrilled to be able to sort of walk that balance again together with you and using your feedback and input, but both focus on organizing and supporting systems change and transformation, but very much diving down into and exploring other ways to reimagine care. So before we dive into some pieces around our value transformation framework, we want to start with hearing from you, and we're going to ask you to both use the chat feature that Luke reminded you how to do, and also raise your hands. So again, chat and hands raised. And our question for you that we want to start today with is, as we begin this Elevate 2021 year, and as you're considering, and we imagine that for those that you're joining today's call because you are committed or interested in using the value transformation framework, overlaying it on existing work, or possibly starting new work. And so as you think about potential value or use of the value transformation framework and the Elevate Learning Forum, what is it that we can do to help support you? Now, we recognize we can't be all things to all people, but we very much, it's a very genuine request for your asks, and how is it that we can best, as we go into 2021 and structure our design and our work, what is it that we can do to best support you? And for those of you, some of you may be on the line and know that last week we did have a call with PCAs and HCCNs from around the country, asking some similar questions and diving a bit deeper about what areas we can explore. So this both builds on that conversation from last week, includes the health centers in the conversation, but again, anyone on the line, whether health center, PCA networks, or national partners can respond to that. So please type in the feature, and would anyone at this time, I'm going to see if we have any hands raised, if anyone wants to do a shout out of top asks or expand a little bit on comments. I'm just going to pause a moment while we're getting some great responses in. Now, again, it's not intended, we won't be able to talk about all of them. As part of these, we absorb them after the call, but certainly we have our team on the line. We have Luke and Camilla. Luke's in particular looking through your comments and your thoughts now, and as appropriate, we'll weave them in throughout the hour or circle back to particular comments or questions. So I'm going to just peek a moment. I hear one from Barbara saying that I would appreciate receiving from my fellow health centers samples of provider and specialist schedules with both in-person and virtual sessions. This would help us better accommodate patients seeking virtual visits. Great comment, Barbara, and we've heard lots of requests both on our PCA network call last week and on other Elevate calls at the end of the year, and interest and expression for support, tools, resources, guides, et cetera, around virtual visits. And so we hear that, and we are absolutely prepared and looking to address or look through the lens of virtual visits quite a bit in the 2021 year. Other folks, I'll just shout out a couple. Staff and provider engagement, workflows and best practices, how to engage patients effectively and meet quality requirements, excellent comments. Again, lots around workflows, change management. So I think you're all hitting on topics that we're building into the curriculum, and again, some of these specifics will help ensure we hit and target the kinds of topics that you want to see happen. So I'm going to continue to move on. I'll check if there's any hands raised in the meantime. I don't see any hands raised yet. I do see, I'm going to call out Lisa Ramos' comment about value-based payment, because that was very much a topic that came up with our PCA and HCCN partners. And we hear you loud and clear that in this changing world and the health center still continuing to transition from volume to value-based care, getting paid for services and transitioning payment methods. And again, even in this COVID era, being paid for virtual visits, vaccinations, those kinds of things, I think are foremost in a lot of folks' minds. And so we want to give attention and figure out the best way to give attention to that and to work through it together across the country. Okay, Luke, I'm going to ask you to continue sort of scrolling and putting together some thoughts and comments that we can circle back to. So keep your comments coming in, and we'll revisit some of those a bit later in the hour. But we're going to transition for a couple of moments now to make sure that we're all ready for this year ahead and that we're all in the same place. We're starting up as a cohort, and there are really 3 pretty simple steps to get started. So the exciting part to us about this is a national forum that's open to all health centers, all PCAs and networks, and all national cooperative agreement entities. So we make it free of charge to all entities, and we invite you all to be at the table. And we think that is the value in this forum. The sort of quote-unquote cost or ask we think is fairly minimal, but still there are a couple steps that we ask that you walk through to be considered a participant in Elevate. Again, most of you have already completed step 1 because you're on this call. That's the renewal or registration. Some of you may not have completely done the renewal, but still received an invite today. So again, we welcome you to register and encourage you to register. Just a statement about that, because we have gotten a couple questions from health centers. If you were a participant in 2020, you do not automatically roll into the 2021 year. So each year we ask health centers, PCAs, networks, et cetera, to renew and or if you're new, register for the project. So again, those are the links. You can even take, there's only 4 or 5 questions. It literally takes just a couple moments. If you haven't completed that step, feel free to take a moment or 2 while we're talking here and you can complete that step. But it's the center box that we really want to sort of laser focus on right now, because this is our baseline work that we want to have happen really in the month of January, so that we're all moving into the new year, again, as a cohort and having completed what we call the Value Transformation Framework Assessment. And I'm going to flip to the next slide for a moment and then flip back to this slide. Oh, I'm going to go 2 slides, excuse me. So the Value Transformation Framework Assessment. It's pretty straightforward. There are 15 change areas that make up the Value Transformation Framework, and the assessment is 1 question for each change area. And so again, many of you have completed this, you're understanding this, but just to reinforce for those where it may be new or where there may be some confusion of what the assessment means or when we ask you to assess. So we ask you pretty simply to state, if you're a health center, you're being asked where you see your health center on a continuum from 1 to 5 for each of these 15 areas. If you're a PCA, a network, or a national partner, you're asked from a coaching perspective. So where do you see yourself and your ability to coach along, say, improvement strategy is one of the change areas. And then we have 2 additional questions for the PCAs, networks, or national partners. And those are coaching skill kinds of questions. So there's actually 17 questions on the PCA, network, and national partner assessment. So going back my 2 screens, again, if you have not already, we ask that if you are a health center, you have 3 or more senior staff complete what we call the organizational assessment. We call it that because, again, you're assessing where you think your organization is on the continuum. We often get the question, why 3 or more? Because we want to avoid sort of coming at it through the lens of one particular person. We ask for at least 3 so that we can kind of triangulate or average the scores. And again, that's what the program does for NAC. So we don't see the individual scores, we see the average scores. What you'll see on your end are the scores for your team, and you can see how many people have assessed from your organization as well. If you can have, last year, sometimes we had some health centers that had 10, 12, they asked many staff to complete it. Again, it's really your call how many and who you want to have do it. but our request is that at least 3, and again, we would ask that those of senior level or some senior positions be involved in that thinking and completion. Again, you can see the bottom button, the PCA network and national partners. It's 1 or more people because you're now answering it from the perspective of you as a state, regional, or national partner coaching or working with or supporting health centers. So again, that's kind of your entree, 1 or more. And then on the right side of the screen, just reminding you that we do have this online platform. Again, most of you on the line are already a part of that platform. If you are not yet, don't worry, you will get connected once you've completed steps 1 and 2. So once your health center is registered, once your health center has the 3 or more, the staff assessing and or the, again, PCA network, et cetera, you will, in fact, after you register, you will get the link so that you can connect to the value transformation platform. What's really important to understand is that while any of you who are continuing on from 2020, even if your health center is not yet registered, you currently still have access. So we did carry over access to the platform, the Elevate closed community that sits on the platform. We continue that access into January. That access will close in February if you have not registered for the 2021 year. So just know, again, please walk through steps 1 and 2. That will be your entree, and you will have full access to the closed Elevate community that sits on this platform. So before I turn it over to my colleague, Camila Silva, to lead us through some more about the value transformation framework, we want to just get your questions or comments about support that you need, if any, about the value transformation framework assessment. So it could be questions you have, it could be support that's needed, it might be application of it or how you're using the tool. So please type in the chat box or raise your hand if you would like to speak. We'll take you off mute. Let me just see if we have any hands raised. Not yet. So while you are doing that and putting comments in the chat feature, again, questions, support, or comments, we'll have Camila walk through the slides at the same time. She may answer some of your questions, but it is still helpful right now for you to log those questions, comments, or thoughts. And so with that, I'm going to turn it over to Camila Silva.
Thank you, Cheryl. Can you hear me okay?
Yes.
Perfect. So for the assessment, the first thing that is going to be really important is go to reglantern.com/VTF, and there you're going to see this one single button, Get Started. That is a place that you're going to just sign up to the platform, and once you sign up, they will send you an email where you confirm your email address, and then that's when you're going to have access to the platform. Next slide. Once you go into the platform, you will see this option. You might see this option of Add a Health Center, and what is really important is that you don't click there. You actually go to where you see the circle, the NACHC Value Transformation Framework. This is where your assessment is going to be, so you don't need to add a health center just now. You can add it here. You're going to go through this step, and that's where your assessment is going to be at. Next slide. Now, once you go into the assessment, and you'll see, even though it's a little bit faded, on the top left, you'll see NACHC Value Transformation Framework. That's how you know you're in the right place. There, you're going to see this Enroll. This is where you're going to add your first name, last name, and the health center that you're with. And I see a few of you asking that you don't see your health center listed. So if you don't see your health center listed, they will have a little pop-up that says, I cannot find my health center. Once you submit, it takes a few days for them to come through, but usually we see some response within a few days. If in a few days you still don't see your health center, please don't hesitate in emailing us at thequalitycenter@nacc.org, and we'll make sure to follow up to add your health center. Next slide, Cheryl. So once you register automatically, then you're going to go to My Organizational Assessment. On My Organizational Assessment, you're going to see the 15 change areas, and on a scale from 1 to 5, you're going to be able to rate how you perceive your health center is in each one of those change areas. One thing that is really important, if you have completed an assessment in 2020, you are going to need to complete your post-assessment. And the way you do that, you simply go to My Organizational Assessment. You will see your 2020 scores. Then you can make any changes you deem fit, and then you click, again, Submit to NACC. That step of submitting to NACC is how we receive the assessment and how we can credit you for completing it. I think there's one more slide. And then, Cheryl, did you want to cover this one, or did you want me to take questions?
Yeah, if you want to cover this slide, and then we'll go to the questions.
Perfect, sounds good. So one thing and why we push the assessment so much, once you have completed 3 or more assessments, your health center becomes eligible to apply for scholarships, and also you're going to be invited for a trial membership of an online document management platform. And the date that the Reg Lantern platform will be demoed to you all will be March 4th at 1 p.m. So this is a really great opportunity for you guys to have this trial of the platform.
Great. Thank you, Camilla. Well, we have lots of questions coming in around the assessment. So I'll start with them, and Luke, you can jump in if you see others that I'm not covering, or we can sort of work together on this. One is just related to the overall slides. So to reinforce what Luke said at the beginning of the hour, which is that the slides would be emailed, or excuse me, as a part of our end of our week, we email the link to the online platform, and that's where we post all of the slides. So again, that's part of the sort of reason or importance of making sure that your health center is registered for Elevate, and then you will gain access to the online learning community. So Camilla, let's start with a couple of these questions. And the first one, I think you answered, but let's say it specifically. If our senior management did the assessment in 2020, do we need to do the assessment in 2021?
And that is a yes. So if you've done it, you need to do it again. And the way you do it, again, you just go to My Organizational Assessment, make any changes, and click Submit to NACC. And Cheryl, you're muted, I think.
Excuse me, thank you. Another request was for the link. So I think, Camilla, will finish this Q&A, and then maybe as we continue in slides, we'll ask if we can enter the links for folks right in the chat feature. That would be great.
Sounds good.
Another question is how a health center can find out if they have completed 3 or more surveys.
Can you go to the previous slide?
Sure.
Thank you. So the easiest way for you to do it is for you to go to Health Center's current scores, and there you're going to be able to see who submitted and when they submitted their assessments. And I did see a question come up around, do we need to complete again even if we did it last month? No. When we say 2020, we mean the start of 2020, so your pre-assessment for 2020. If you did it on November, December, we are counting your assessments as completed.
Great. Another question came in from someone that said they've not been able to enroll. And I'm unclear whether that might mean Elevate itself or the VTF. So maybe if you could speak to both, Camilla, just to cover both bases.
Yeah, so if you cannot register for Elevate, so on the links that Cheryl had sent before, and we'll make sure to copy, and I see that Edward said Elevate. So for Elevate itself, the way we register is just completing that form. What I can do is if you can message me on the chat just your email address, that way I'll be able to do that follow-up, and that works for anybody. If you're having trouble with anything, please don't hesitate in emailing us. And for the assessment, if you cannot enroll in the assessment, there is a support button on the platform that you will be able to message the regular entrance support team.
Great. This is a bit of a different question. It's not specific to the assessment, but I think an important question that we answer here is if the forum, and I think that's referring to the Elevate Learning Forum, is for senior staff or leadership. And the answer is absolutely. In fact, we found that some of the most active participants last year were senior staff when we looked at who participated in webinars and or various engagement or tools. So it really is the Elevate Learning Forum. You will find that even more this year, and we'll talk a little bit about that today in some of our final slides, and certainly much more about that in our February Learning Forum. But this year's session is going to provide both different voices and some different sort of streams or opportunities for different staff. So if you're, for instance, a QI or staff, you might tune into these particular areas, and leadership, you might tune into these particular messaging. But it is important to say that the monthly forums, the second Tuesday of every month, which we call our kind of core learning forums, are really designed to hit multiple audiences at all levels across the health center, PCA network, national partners, et cetera. So we are thinking of our second Tuesday of every month as the largest group, and then there will be opportunities, just as there were last year, but some new and different ones, but some opportunities to kind of splinter off or discussion groups or peer networking or those kinds of things. But it is very much designed not only for senior staff and leadership, but other levels as well. Let's see here. I think a PCA or a network in this case, but it would be relevant to a PCA as well, is asking when they would receive a listing of health centers that have completed registration. That's a great question. I think, again, over the years, we have tried to work closely. We've done it a little bit differently every year. We've tried to not place too much burden this year on PCAs and networks for sort of calling out or following up with health centers, given all that's going on in the environment. But we are trying to work very closely with those PCA and network and national partners, and we'll do so more during the year. But to answer specifically, Rebecca, your question, I would say that probably the most relevant time is there is some messaging going out this week. So I think by the close of this week, so if not Friday, then Monday's a holiday, so Tuesday of next week, we can get the PCAs and networks some listings. Again, if you have questions, and we have had PCAs and networks reach out to us, that's probably the best way to do it, is send a message to the Quality Center and ask for your particular PCA network, or again, probably less relevant for the national partners, but your PCA or network, send a request, and we have responded to those questions individually with lists to date. So that might be the best way to handle it right now. We have Shelley saying, and this might be some other health centers. I know a number of health centers have gone through name changes or doing business as, you know, they kind of operate under a couple different names. And so, Camilla, the question is that they completed an assessment under a previous name and they could find it, but they're I would actually ask it multiple ways. This particular individual is requesting a change, so if you can respond to that, but also respond to the question, which I think you already hit on, about what do you do if you don't see your name as it's listed in the list. If you could just say that, maybe reinforce that.
So if you want to change your health center name because your HRSA approved name changed, you can say, I cannot find, right when you're enrolling, you can click on, I cannot find my health center, and explain the situation, and then the regular entrance support will update that for you. And if you cannot find your health center as you're typing up on the previous slide, Cheryl, if we can go to there.
Oh, sorry. There we go. Is that good?
Yes, perfect. Thank you. So right where you see health center name, as you're typing, it's going to start populating. If you don't see it, you will see something come up right below this line that says, I cannot find my health center. You can click that, and you'll send us support desk ticket to the Reg Lantern, and you can put in your health center name, and that will be added.
And Camille, somebody, Vicki is saying that she's trying to complete the assessment, but she's just seeing, I guess, the words NAC Value Transformation Framework. Would that happen if somebody goes into the public platform that isn't registered? Could you say, is that a scenario you're familiar with?
So if you're just seeing on the Value Transformation Framework right at the bottom, so if it is on the bottom left, sorry, of your screen, then yes, you are in the public page. And what I would suggest is just go into reglantern.com/VTF, click that Get In, and it will take you to the right place.
Perfect. And then we've gotten a couple questions about a PDF copy of the full assessment. And so what we do have, and maybe what we'll do is add this, and I'm addressing this kind of our Quality Center team, where we can add the version that we have of the assessment to our web page so that folks could readily access it, because what we have is what we call a sort of a shareable version. As you know, for those of you who have completed online, it's not in a format that can be readily printed. You know, it's laid out kind of horizontal, and so for a variety of reasons, it's again, it is not so much suited to printing. But what we've created is a two-pager that, and I think the request here that I'm seeing from Vicki and some others in the chat feature is copies to share with leadership. And so what we do is we show the 15 change areas, we show the 5 points that exist on the continuum, and we kind of show the level 1, which is the basic, all the way up to level 5, the expert. And so I think we found that that's been a very useful tool for sharing with folks. It gives a good background on what the assessment is, what it's potentially useful or helpful for, and gives the scale, etc. It doesn't have all the minutia that's on the website, which I think is okay, because it's a pretty lengthy, you know, it's not that, but the level of detail. And then the other thing that we have learned through some of NAC's, and I know a number of you have mentioned the payment readiness reform tool and some other tools, is that when folks have various types of kind of paper versions out in the field, then we lose that database that's rich for health centers. And so again, we've created a tool that you are free to share with your leadership and show them what exists, the scale, the kinds of questions. And then at the same time, we encourage, and everybody, there is no cost, and all health centers, all PCAs, all networks, and all national partners can register on Reg Lantern. So it is accessible and free to all. We just want to draw people to that central location so that, you know, that database integrity is maintained. So, and then we do see a number of questions about the Reg Lantern trial. So I think I want to speak to that a moment. I'm going to go into this this slide, and let me just see. I think I have. I'll come back to that in a moment. Again, the Reg Lantern platform, for those of you who may not be familiar with it, is an online document management platform. And so really it is designed to help support you in your work around health center, you know, compliance around the health center program requirements. And so for those in 2020, what we did is, if health centers, or I should say health centers, were invited at the beginning of the year to a demo that was done by Reg Lantern, and then they continued the communications. Again, this is not a product that's either supported or endorsed by NACC, so I just want to be very clear on that. Reg Lantern happens to be the platform where they host the Value Transformation Framework, but again, we do not endorse their product per se. NACC is not in a position where we endorse any one particular product. But because of the partnership we have with Reg Lantern, they have been very generous in making this trial subscription available. Again, ultimately, they hope that this becomes a tool health centers would like to purchase. As people are noting, it can be very expensive. The cost in part depends on whether you're purchasing it as a single health center or whether, I know there have been several states where a PCA has gone in and done some group purchasing, and so that brings down the cost, but it could be, you know, $8,000 up to upwards for a membership. And again, I don't even have the current pricing. That would probably be a base price, and it certainly can go way up from there depending on different elements. So the beauty in participation in Elevate is you do receive a 6-month trial membership to this platform. Again, the only requirement is that you are registered, so you have to complete those 4 or 5 registration questions. You're a part of Elevate, and that if you're a health center, that you've completed your 3 or more assessments. It will be those health centers that have completed those steps that receive the invitation on March 4th at 1 p.m. And again, to be a part of the free access, you have to participate in this March 4th event. Again, they can talk with you if there's any accommodations, if someone from your team can attend that. But it is designed that you've registered for Elevate, you're enrolled, you've completed the 3 or more assessments, and then you attend this demo, and that unlocks the key to your 6-month online trial. For PCAs and networks, again, I believe they certainly are inviting all of you. I imagine national partners certainly will be included in that, to the demo, and then I think that's where discussions open up about what happens from there. But they certainly want to share and show you the tool and see if that might be something of value, for group participation or membership among your members. So it's a pretty exciting opportunity. And then the Institute for Healthcare Improvement, we're thrilled to say, and I think many of you on the line got to experience scholarships and opportunities from IHI last year. There were over 600 individuals who were offered various opportunities, ranging from the Open School to the Joy and Work online course to the National Forum. So those opportunities will continue this year, and again, will only be available to those who are both enrolled in Elevate and who have their 3 or more assessments completed, or again, in the PCA or the network national partner, have a single person. So Luke, I think you're queued up with a couple questions, so why don't I turn it over to you for a few questions, and we'll go from there.
Sure. So we got a few questions regarding specifics around scoring, or whenever you're going through and doing the assessment, what your scores mean, what the next steps are, and if there's any sort of deadline for submitting the assessment.
Camilla, do you want to speak to how the scores are tabulated, and then I can also speak to some of the application, but maybe the scores first.
So if I understood correctly, the scores is which score do I assign to my health center? So one thing that we ask, and you'll see on the instructions that are on the assessment itself, is if you complete, say, all of the items from level 2, but you just complete some of the items for level 3, we do ask you to select number 2. So that way that number 3 is what you're achieving towards, and the way it's tabulated is once everybody on the organization submits their own score, you will see the organizational average, and that's how you have your score.
And then part of the question, maybe, let me go back to this screen. So Camilla, correct me if I'm wrong. So if someone's looking at my organizational score, this one says a 35 out of 75. Essentially, it's looking across, again, for each of the 15 change areas, an individual will have ranked something on a 1 to 5 scale. And so this is taking the average across the numbers they selected for those 15 areas. Is that correct?
Yes, that is correct. And if they want to see the average of from everybody that has completed an assessment, they would go to Health Center's current scores, and that's where they would see the average of everyone that has completed an assessment.
And I think just to emphasize to everyone, this is not a test. And so when you see a score of 46%, those of us who spent quite a bit of time in school think, oh my gosh, I scored a 46%, that's a failing grade. That is not at all the way this assessment is viewed. Again, it is a continuum, it's a journey. And just as we say in Elevate and Transformation, it's a continuum. And so there may be some things on the scale where you're at a 1 or a 2, you're at a more basic level. As an organization, that could be for a whole host of reasons. It could be size, it could be age of the organization, it could be level of staff, it could be competing priorities, it could be a whole host of reasons. Again, it's not a good and bad. It's an assessment, and what it does is allows you as an organization to then say, for instance, I'll give you an example. We had many health centers where the payment change area was one of the lowest ranking scores among all of the 15 and change areas. And that was probably for a host of reasons last year. It was the complexity of the environment. It was COVID-related financing. It was transition from volume to value. Again, it will be individual for your particular organization, but what it does is it highlights for your team, and in the case of PCAs, networks, or national partners, for you as an individual working with health centers, it highlights areas that you might want to spend, maybe you want to focus or dive a little deeper, or those kinds of things. So that's really the value or the application use of the value transformation framework assessment. Luke, back to you.
Sure. So we got some questions about the PCA, the HCC, and the NTAP version of the assessment. So first of all, one question was if it's on the same website, and I think we had discussed this briefly, that yes, it is the same website. And when you go in, if you had previously registered as an HCCN or a PCA, that you'll have to, since this is a new platform, you'll have to go in and register again. So just set that up. You'll have to set up registration on this website. A couple questions that we've received confirming that if the count of the number of assessments, and somebody had asked if they'd already done 2, that they still need to only do 1, and that is correct. And then another question just came in that is similar, that says 3 assessments by 3 different people in the organization in the same year counts. That is correct. And Camille, I don't know if you want to add any additional input around, that timing, that it's not just across one whole year, but it's in a smaller time frame.
Yeah, absolutely, Luke. So we started this process of asking people to join Elevate 2021 around October, November of 2020. And from that moment on, we have, if you completed an assessment from then on, we are counting you as completed. And I am seeing one question that came up that I just wanted to touch by, which is, we can only do 3 assessments, or can we do more? There's no limit on the number of assessments your health center can complete. So if you have more staff members that would like to complete the assessment, by all means, they can go ahead, register, and complete the assessment.
And Camilla, could you comment on, we have Lori Mecca who said her health center is listed as awaiting approval. Is there anything we need to do? And I think there's a registration issue. I know that has come up before, so if you could respond to that, please.
So if you have awaiting approval, it should be approved within a few days. If, say, you asked for it on Monday and by Friday it's still not there, feel free to email us at thequalitycenter@nac.org, and we can go ahead and make sure that your organization is added.
And that's, I think, the last piece. So that should only come up, and confirm if this is correct. The only time you would, for most organizations, again, vast 99.9%, you'll find your health center name or your organizational name in the scroll down list. But it's if they're not finding it and need to ask that it be added, that's when they get that message. Is that correct?
Yes, that is correct.
Okay. Okay, I think, Luke, I'm going to ask you to maybe hold a moment, but queue up in case for some questions at the end. But we do have a couple more slides and content we want to cover, and then we can circle back. But one, we want to just give a shout out and acknowledge a big bulk of health centers who already have their 3 or more assessments completed. So fabulous, and congratulations. So hopefully you see yourself on the screen there. Great job. And you already are eligible for the invite to the Red Lantern demo, who somebody correctly pointed out that we have the 2020 year. So we will correct that. It should say March 4th, 2021. So thank you for whoever pointed out our error there. And again, just congratulations to this host of health centers. A few words about next steps, including direction for 2021. And one of the ways that we're looking to roll out the year, I spoke a little bit earlier about the importance of partnerships and working in concert with our PCA network partners and certainly our health centers that are all participating. And for those of you who have been a part of the project in the past, you may know that we've had voices from the field on most of our learning forums. In fact, we often like to have 2 or maybe even 3 voices to sort of bring to life the various change areas, application of evidence base, et cetera. For this year, what we are looking to do is select 2, possibly 3 health centers that would be featured throughout the year, meaning, doesn't mean we won't include others, and we very much can and will bring in others from across the country, but that there would be 2 or 3 consistent voices that would join our monthly calls and talk about and be willing, if depending on the topic we're talking about, to be able to speak to it. So if we're talking about leadership and some of the evidence-based interventions around leadership and the leadership action guide and talking about whether it's a business case or psychological safety or those kinds of topics, then maybe the CEO or another member of the C-suite would be willing to join that call and speak about some of the health center's work around leadership. Similarly, on a call around care teams, for instance, that a member of the care team, whether it's a provider or a care manager or MA or someone, might be able to join and speak to some of the evidence-based interventions that are both bringing to life the action guides, but also adding their own experiences, their own lens, their own application. And that they could do that together with PCA and or HCCN. So for instance, if you're a health center in a given state, maybe your PCA is also joining and talking about not only what you're doing around a particular topic, but how they're executing that at a state or regional level for health centers. So if this is of interest to you, this is our next slide. If you're interested in being a featured health center, and I'll start there because, again, we're looking for 2 or 3 that would be featured throughout the year. Please feel free to put it in the chat box, or if you don't want to put it in the chat box, you could send us an email at thequalitycenter@nac.org. We would love to hear from you, and then either we or you could reach out to your PCA HCCN partners, and then the reverse could happen where we have a PCA or HCCN partner and they might reach out to a member of theirs and say, hey, are you interested in being featured? And we'd like to, come in as appropriate at different points throughout the year. So we wanted to offer that opportunity. We hope we actually get more requests than we can accommodate. So again, just understand that we'll probably only select 2 or 3, and then we will use interested folks certainly throughout the year at various points to bring to life various change areas. But again, please do put in the chat feature or send us an email and let us know if that is of interest to your organization. So getting ready now for the journey. I think that I saw in the chat feature, someone asked the question about sort of order of registration, meaning I think it was the CEO who put in the chat box that he or she was going to sign up first, and then how do we get the others on board? So the good news is, in your enrollment, we start that process, but there is also this link that lets you add folks. So say you've already completed the registration, you're already a part of Elevate 2021, you already listed the CEO, you already listed your lead person, but you want 6 more people at the table. You want 6 more, you want there's going to be sessions around HIT, so you want that person or persons involved. There's going to be a deeper dive on care management. Reimbursement is going to be a huge topic, et cetera, et cetera. Click this link or you can scan and bring up a form that is, again, super simple and basically asks for the contact information of those person or persons. The Quality Center team adds them to the database, and they get the invites. Again, if you are added to our database, you will receive the 12-month, the invites for the whole series. So February through the end of year, December 2021. You are always free to, at any point, and certainly not to join them or to decline them or to turn them off, but we do send them as a series and invite, if we receive the contact information, we will send you the invites and allow you to choose whether to opt in or opt out, but that way you have the information. And then as we get ready in our last couple minutes to close the call, if there's any other information, again, we realize these are challenging times. You're faced with a lot before you. And so we would ask you to help us just understand more deeply the kinds of any challenges you might be facing to getting started. Again, those 3 steps that we hope are fairly easy. That's enrolling, renewing, or registering for the Elevate. So that's step 1. Completing the assessment or assessments, that's step 2, and then getting yourself online in the platform. Again, we'll provide you the link. So making sure you're renewed or registered, making sure you complete your assessments, and then making sure you're connected to the platform. Let us know if you're facing any difficulties or challenges, and any help that we can provide in getting the word out to others. Hopefully many of you on the call received the video that we recently released, and you can feel free to share that with other folks. That provides in 2 minutes, it provides a nice, hopefully a nice overview of the framework and what's to come or what might be offered to Elevate, but we're also open to other ways that we can help support you, get the word out, or share information in your own teams. I think with that, Luke, maybe I know you've been monitoring the chat box, so why don't we take 1 or 2 more questions that we can tackle on this call, and then we'll see what more we may need to tackle offline and or follow up in the next week or 2.
Sure. I've got one technical question regarding the assessment, and then one about being one of the featured health centers. So first, Cheryl, I'll give you the question about being a featured health center. If any health centers are interested, as we've gotten many in the chat box saying they're interested and they want to find out more information, what do they need to do to find out more?
So for those who express an interest, anyone who, let me say it a different way, anyone who expresses interest today, I will be following up with an email over the next couple days to provide a little bit more detail and really to have a conversation. But to say it pretty simply, the requirement or the ask is that in order to be featured, that a health center, one, is willing to have a representative, so it doesn't need to be the same person all the time, but and frankly, it wouldn't be the same person because there's different change areas, but would be willing to have a representative from your organization on each of the 11 remaining calls, so February through December of next year, and that you're willing to help demonstrate, or a better way to say is bring to life the change area. So I'll give you a few examples of those. Like risk stratification would be, we're going to talk early on about population health management and risk stratification and so it could be that someone is talking about how you're using, what strategy do you use, how are you deploying it? Maybe it's talking about how you're risk stratifying right now to be thinking about COVID vaccination while also thinking about diabetics, while also thinking about hypertension, et cetera. So it would be, that would be an example. That would be somebody who could join a call and speak to that particular change area and the things you were doing around risk stratification. Again, care management might be that you may not even have a care management program yet, but maybe these are the things you're willing to do to get started, or you're interested and you're giving feedback on what it would take for a health center who doesn't yet have care management to be able to launch that. So it's really being a vocal spokesperson, or again, bringing to life experiences around the 15 change areas. So hopefully that answered the question. But for today's purposes, it would be indicating in the chat feature or sending us an email that you'd like to be considered as one of those 2 or 3 health centers.
And Cheryl, I've received several questions, or a few questions the last minute or so, for some confusion around if there is a cost for Elevate or not, as well as any costs around the Reg Lantern compliance tool. So could you please clarify on that?
Yeah, so I am happy, on behalf of the whole Quality Center team, we are thrilled to say that there is no cost for Elevate. The resources to support the work that we do here at NACC through Elevate is made possible from a grant that we have through the Centers for Disease Control and Prevention related to cancer screening. And for those of you who have been a part of this effort for a few years, you may know that we started this value transformation framework back in 2000. The framework itself started back in 2016. We began to roll out application of it or operationalizing it in 2017. And so this is, we've been going now 4 years or so, growing in size and scope and application. But at its core, our premise and why the CDC is so thrilled to continue to support it is because we believe that you can improve multiple clinical metrics, including the UDS colorectal cancer screening metric, by focusing on taking a systems approach. So the short answer is we have CDC funding to support this work that we are doing, and therefore it is offered to all health centers nationally at no cost. And in fact, it would be our goal and our joy that all health centers nationally would come together in this work, and so that we would have the majority, if not all, health centers really connecting in this work of transformation that's so important for the work that you do every day. So I think with that, the last question of the day, I know there's lots more in the chat feature, so we'll take a look and see if there are some questions that we either need to follow up with online, we can fold into other materials, possibly Friday's email that, again, for those of you who may not know, we typically send, we don't send an email if it's not necessary, but if there has been a learning forum or if there's a need, we send a message at the end of the week that kind of capstones the week and provides links so that you can access slides, recording, etc. So do know that that will come out to this Friday with today's materials, and if there's some key information we need to follow up in from the chat, then that might be an opportunity we can fold it in. Luke has brought up our evaluation questions. This is part of our important feedback that's necessary for our continued funding to make this freely available to all of you. So we hope you'll take a minute to give us your honest feedback on today's call. And again, we are so excited to begin the 2021 year with all of you and ask that as we get ready and for the February activities and start and content, that we look forward to seeing renewals, registrations, assessments, and then again, providing you all access to the online platform and invitations to Reg Lantern. So more to come on all of that. Thank you all for joining us today and for your important feedback. We look forward to working with you in the months ahead. Thank you.